Good morning. Welcome back to the Retirement Report. I'm Hank Parrott, your host. All right, we're going to jump right into the program and pick up where we left off last week talking about Medicare. And again, I've got my good friend Warren Cranford joining me today. And Warren, as I said, is a benefit specialist. So if you need some help and you call my office, we can arrange a meeting with you and Warren to where you'd be able to, if you need some help with Medicare, you got questions, maybe you're with open enrollment just around the corner starting October 15th. You might want to, schedule a meeting, talk to him about what you currently have and what your options are, see if there are any improvements that could be made for you there. And for those that are going to be maybe signing up for Medicare the first time, it's a good time to get some information about how that works. And in fact, for those of you who are signing up for the first time, we're going to talk about the initial enrollment period. When you turn 65 is when you are eligible. And Warren, there's basically we'll talk about that 7-month initial enrollment period.
Correct. Folks are turning 65, and especially if they are receiving Social Security at that time, typically they will be automatically enrolled in Medicare. But if they don't, and when they turn 65, that window is 7 months, the month of their birthday, 3 months prior to their birthday month, right, and 3 months after their birthday month. So if they're receiving Social Security benefits, if you're receiving Social Security benefits, you can actually enroll in Medicare 3 months before. My clients, I typically advise them if they haven't seen or received their Medicare ID card, let's say by the end of that first month, I typically advise them to go ahead and make a phone call to the Social Security office and just kind of check in to see where it is in the process, because there may be a hiccup. But if they aren't receiving Social Security benefits, and they're turning 65, that is their window, their window or period of time that they can enroll. And if they want to sign up and enroll in Medicare, again, they can make the phone call. They won't automatically be enrolled, but they can make the phone call the 3rd month prior to their birthday month, and 3 months after their birthday month. So okay, that's the window of time that they can
there you
enroll.
Go. So basically, if you're going to be turning 65 in October, as an example, you could have started over the last 3 months, July, August, and September. Anytime in that window, your birthday months after, so again, using October, that'd be November, December, January, anytime in that window. And you want to do that, take advantage of that, because as Warren said, otherwise you could face a penalty for, if you sign up after your enrollment period, if you delay for whatever period of time, taking Medicare Part B as an example, you could end up with a penalty, and the longer you delay and then decided you wanted to get Part B, the bigger that penalty. And it's a permanent penalty. Once, if they're gonna penalize you as far as paying a higher premium, and it's not just, oh, well, you'll get that for 1 year or 2. No, it's for life. So you're gonna live with that mistake. So we wanna make sure you get enrolled when you need to get enrolled. Now, having said that, there are exceptions. One of those being if you're working past the age of 65. So for those still working after 65 who have health care insurance through their work, then you have choices whether you want to sign up or, and Warren, in this situation, I think most employers, if you're still working and you have health insurance, you turn 65, I think they want you to at least enroll in Part A. Isn't that correct?
Correct. Yeah, they and depending on the size of the company, and your HR departments are the resource to go to. I advise my clients to ask questions of the company's HR department or whoever handles the employee benefits to verify and make sure how Medicare coordinates with their company's group insurance. But typically, like you said, if I have a client that calls me and just wants to avoid penalties, but they plan to stay on the group insurance, and they may have a spouse that's on the plan as well with them, then we guide them through that process of what to do and what not to do to be able to avoid those penalties. But yes, they could stay on their group insurance possibly. Again, that's not a standard, but they would need to verify that with their company's HR department, and but they would call in to the Social Security office again, apply for Part A, because Part A for most the average citizen is free, and as long as they meet the qualifications of receiving Part A benefits, and they would delay Part B, which would help them avoid the Part B late enrollment penalty.
There you go. So if you delay taking Part B just because you don't want to pay the money or for whatever reason, you're not thinking your health is good, you don't need it, just understand that later if you change your mind and want to get Part B, you're going to pay more. The exception, again, if you're working and you have health care coverage through your employer, then you don't have to sign up for Part B. You can delay until you no longer have that health insurance, and you will not be penalized if you do that. So now the next thing we want to cover is the different parts of Medicare, and in particular there are two options, if you will, for Medicare coverage, two paths you can take. One I refer to as original Medicare, and the other Medicare Advantage plan. So original Medicare, this is where we get into Part A, B, D, and typically a Medigap Medicare supplement policy, and in Part C, Medicare Advantage and how those work. So Warren, on this one, on these two different types, why don't you start with original Medicare, those Part A, Part B. Talk a little bit briefly about those and how that works.
Okay. Yeah, Part A of Medicare is your hospitalization. Yeah. And so that's what it covers. Sometimes there's some medical, and Part B is your medical, so are sometimes considered outpatient. Right. And so those are the two parts that you receive when you sign up and enroll in original Medicare, and then of course Part D is what you mentioned is the drug standalone drug plan is Part D of original Medicare. And so when you say paths, I like to use that word myself as well with clients when I'm explaining how it works, because there are two paths. Like you said, Part A and B, and D would go along with it, but that's when people begin to look at, with original Medicare, you have deductibles, you have co-insurance, 20% of an unknown amount that, Medicare covers 80% of a hospitalization, but whatever that 20% of whatever those charges are would be left to the beneficiary.
And one of the things you get into, Warren, and we're going to, of course, break these down in more detail for everyone, but on the differences on those, one part being that of travel. So if someone's going to live in different areas, or if they're going to, in particular, met with a client just yesterday, in fact, that has a home in Italy. And so they spend, a good part of the year in Italy, and then some of the times here. And in a situation like that, Medicare is not necessarily going to cover everything that you're going to, in particular with foreign travel. If you're going to be over there, it's mainly just emergency type care coverage to get you stable or in a good enough situation to get home again. Exactly. And this is something to consider, folks, as far as if you're going to, and now it's interesting, but at least in Italy, and if you're going, I don't know, this is probably a small part of the population, but there are options available for you to how you can cover health care costs in other countries. The other thing is looking, though, more for what is more common, and that's those that have places, that they, snowbirds that maybe go to Florida during the winter. Right. Those that have where they may be in other states. Now that's again where the difference between original Medicare and Medicare Advantage, important to understand how those work. Exactly.
If they are traveling, as I explained the other day, I had a client that I was working with and said, if you're going to, you're going to retire at 65, receive Social Security benefits, and you're going to jump in your RV and travel and see the U.S. for 3 or 4 or 5 months out of the year, then yeah. Advantage plans or Part C of Medicare isn't going to fit that lifestyle, and so you would want to consider original Medicare with a Medigap or supplemental plan and go that path. So
there you go.
Correct.
All right, we're going to take a break. When we come back, we're going to delve in a little more deeply into how Part A works, Part B, the different parts of Medicare, and more about Medicare Advantage plans and some of the distinctions there as well. But first, a break. Join us here. We'll be right back on the Retirement Report.